Hi everyone, thank you for stopping by to watch this clip. And if it's your first time, thank you for if it's first time to stumble across this channel, thank you for stopping by. And if you've come across this channel before, also much appreciation to you. Um, it's been a long time I've posted a video here. It is what it is. Be that it may, it is what it is. Being a new country, trying to get things rolling. Trying to you know get your footing on the ground. Get things rolling up strategically before trying to do other things. So anyways, I'm happy to be here. So today I'm gonna have to I decided to post this video, made this video as well as post it online. So in a way to provide information to people that might be interested in pursuing nursing as a career, or know any of anyone that knows any relation, anyone friends are interested in pursuing nursing as a career. So, having said that, I moved from the United Kingdom to this to the United States January 2023. So this couple of weeks here, then I'm making 1 year. So here in the United States. So without no further ado, I'm gonna have to introduce myself. My name is Darlington. So I am that world acclaimed dishwasher. You know what I mean? Yeah, I'm that despised and contemptuous dishwasher that has eventually transitioned from the role of a dishwasher to a registered nurse in the United Kingdom and here in the United States. So it is what it is. Having said that, so without no further ado, I'm gonna have to delve more into this topic and nursing practice in the United States, in the United Kingdom versus nursing in the US. So I it's making a lot of furor as well as waves in the online and offline space. So I find it very remarkable, very interesting because a lot of people, as I earlier said, people could wanna immigrate to the countries, wanna undertake nursing as a profession, all that. So let's just go in. So in this video, I'm gonna enumerate a lot of points I'm gonna use to analyze the differences and provide an insight as well as make a comparative value at the end of the day. So first we're gonna talk about the history. So history of the country, then we're gonna talk history and evolution of nursing as well. So we're gonna talk about that, then talk about nursing education, then talk about nursing practice itself, talk about employment policies and practice, in the both countries, contemporary, so to say. Then we could talk about remuneration, talk about career progression, talk about things like maybe outfit at the end of the day. So without no further ado, let's just go in. So having said that, first of all, um, United United States, was a British colony, and just got its independence 4th of July 1776 from Britain. So having said that, so the US was kind of, people, the colonists that were under, British that were a British subject back then, they wanted to establish a government that would be different. So that led to what we have presidential system of government here, and as opposed to parliamentary system of government in England. So as we go down, you will see how this system of governance, like shape the profession and as well as, create bandwidth, in which the profession will traverse, so far. So having said that, we go to number two, nursing education. So this is a very, very important area in this. I've gotten some couple of messages from folks I met back in England, and one, like two of them. One said, "Oh, can I come to the US and do masters in nursing and this and that?" Another one, "Can I come to the US and do my PhD?" The other one was like, the other lady was like, "Oh, maybe can I come to here and do be anesthetic nurse?" That's the word they use in the UK. So there is nothing like that phrase, anesthetic nurse, here in the United States. So what we have is CRNA, certified registered nurse. That's a different thing for now. So having said that, like I felt like it's very veritable at this moment to provide this information because even me ordinarily before I went to the UK, I never knew that the nursing are not the same. They are not the same in terms of curriculum, in terms of practice, in terms of other things. So nursing education here in the United in the United States, there are two pathways to be, to acquire nursing education. Guys, listen very well. There are two pathways what to get nursing education. So what that means is this: you've acquired the education here, but you are still not a nurse. I will explain further. So in the United States, you could pathway of what they call it associate degree. Associate degree lasts for 2 years, so duration of study is 2 years. So 2 years program. So that's what you're gonna do. And at the end of the day, you've if you pass your exams, then you got the degree. Then the other pathway is what we call BSN model of education. So that lasts for 4 years. So that's after 4 years, if you're successful in your studies, then you've acquired the education. So as I was saying, if you finish this successful completion of these programs, doesn't confer you the automatic wherewithal to practice as a nurse. No, the only way you will become a nurse is when you have successfully completed what the NCLEX examination. So if I guess a lot of people may know what that means, but if you haven't known, NCLEX means National Council for Licensure Examination. So that is the board. Some people also refer to it as the board. So if you finish your nursing programs and you have to sit for the board. So if you don't pass the board examination, nothing, no way for you. You are not a nurse. You've succeeded in getting the educational criteria. That's what you've just got. So this is in contrast to what you have in the United Kingdom. Oh, mamma mia! In the UK is just so direct, so sweet. Like, you know, immediately you finish your nursing. Anyway, it takes 3 years. The nursing program takes 3 years in the UK. So immediately you pass your semester exam, finish. Even before the final or before finalizing the program, in some schools they could go and send your name to the NMC, Nursing and Midwifery Council. Then before by the time you finish your program, you get your PIN, like automatic conferments to practice, automatic. You get PIN, so that's what they use. They use the term PIN, not license. So you get your PIN. You've been registered in the Nursing and Midwifery Council, so you practice automatically. So here in the United States, no way, no way, no way. The only way you could practice is what? Take your exams, take the board exams. So, like my current experience, I've seen a couple of folks, like, in my hospital, I've seen one guy and he works in the SPD, sterile processing. After we had series of interactions, he said, man, I'm a nurse. Not that I'm a nurse. I finished my nursing program anyway. I say, oh, what's up? What's going on? I understand the reading, like, what are you, what's going on? When are you taking for it? So I said, oh, I'm taking in so time. And it's just that illustration. And class is not for the faint-hearted. That's just it. So we go to the next one. That's our educational curriculum or content. So for the guys asking me, oh, can they come do masters, do this one, do you have to understand here in the United States, the nursing education is designed like it revolves around different areas, not a narrow set of nurses. So primarily, some people will say the nursing education is revolves mainly around 5 areas. So that is what: medical, surgical, mental health or psychiatric, then what's it called? Pediatrics, then OBGYN. Some people call it that's obstetric and gynecology. Some people call it maternity health or midwifery in some countries. So what that means, like, if you're gonna be a nurse here, your training program or your academic program has to revolve around these areas. So you have to know what's going on. Like, if somebody's gonna have obstetric emergency or clogeric crisis, you're gonna know what they're talking about. Like, you're gonna have an idea. You know, this is as opposed to what you have in the United Kingdom. The nursing is fragmented, so in such a way, it's narrowed to a particular area. You don't need to know. That's just the training program. It just narrows you. You become either an adult nurse, you become a, what is it called, a mental health nurse, become a pediatric nurse, become a, what's it again, a pediatric nurse, learning and disability nurse, and whatever. So that's what you're gonna do for the rest for your 3 years, and you're done with it. If anybody comes and say, oh, You know, someone was having preeclampsia or eclampsia fit, and you're an adult nurse, it's not your business. You'll be like, what are they talking about? Because fundamentally, you were not trained to do. And that reminds me, like I've seen some clips as well, some video, some kind of, assertions or like inscriptions that people will make, like, people like, oh, um, maybe, it's not to denigrate or so, but some people will like, they can't understand what's going on in the United Kingdom in terms of the nursing itself. But I say like, look, guys, folks, like, if you're gonna have to judge a fish by its ability to climb a wall, to climb a tree, you're gonna make mistakes judging it, wrongly for the rest of your life, because a fish is not genetically and naturally configured to climb a tree. So this is like an analogy you're gonna use in, nothing in the United Kingdom. So it's not, they are not trained for that. So you're gonna understand their training is limited. This is what they do, and they do it well, and they keep the job going. That's it. So if you wanna talk another thing else, that's your own cup of tea. So having said that, so I'm gonna have to move on to the next one. So that will be what, nursing practice itself. So here in the United States, the nursing practice is quite, well, I say it's dynamic, and it's a sense of is revolutionary as well. So here, for instance, the practice changes over time, and again, the system of government also what also plays a role here. So as I earlier said, this country, 50 states, so we have 48 states in the land, in landlocked or mainland areas, whereas two states are not in mainland. So Alaska at the top of Arctic, close to the Arctic, and Hawaii at the Pacific. So each state have their own legislation, have their own like self-government, have their own framework to determine what they want to do. So that leads us to what we call Nurse Practice Act in the United States. So what that means, like, here in the United States, each state have nurse practice act they have developed that defines the scope defines the scope of practice for a nurses, as well as skill sets they will have, and what have you. So this is as opposed to what you have in the UK. So you have a unitary government. So whatever they've set out the model, that's it. It trickles down to wherever you are in the country, and that's it. So in the US as well, nurses have the skill set is so large. So for me personally, I am an operating room nurse, for example. So what I do here in the US as an operating room nurse encompasses the role of three personnel in the UK. So what does that mean? I do the role of an anesthetic assistant. In what in the UK they have ODPs. Those are the ones that do, those are the set of professionals that do that job. So whatever they are doing, I do that. So assisting the anesthesia provider, positioning the patient, doing whatever. Only things that, like, that has to do, like, technical work are in the anesthetic machine. That's why you don't they have anesthetic technologies that does that anyway. So having said that, as a ODP or anesthetic support, do what's it called? For work as a circulator, as well as work of a resident. So I'm gonna give you a tip. I'm gonna give you a highlight of it later on to describe it. So having said that, so here as well in the UK, in the United States, the nurses the nursing practice is geared towards nurses have an increased autonomy to practice. There is also clinical constructs, what we call critical thinking acumen or critical thinking, yeah, critical thinking acumen, clinical constructs here. So, for instance, let me just say for it, like, I work in the operating room. I have to interface with patients from a pre-operative angle, pre-operative level to intraoperative, then post-operative. So, for example, if I go to pick a patient from the pre-op, they could be telling me, yeah, this patient, this patient is on Xeritol, the INR is this, is it like, you're gonna know what the normal range of INR is, international normalizing ratio, as 1.0 below. So if you have a higher high INR, that means you're gonna have to call the surgeon and say, no, you have to look closely. So, like, you're gonna know, for instance, PTH, parathyroid hormone. So you're gonna know the one, the normal range of it, and all that. So it's sort of, in the UK, no, in the UK, no, you have no business with those things. You, even if you know it today, for your, maybe you're trying to know what's going on, nobody is gonna ask you that tomorrow. Yeah, there are residents, people that are gonna do that job. So that's not your job. So it's gonna ask you. So having said that, so that's what I'm trying to say here. In the United States, you have to be on top of your game. The practice here is so fast paced. You have to have an idea of clinical construct. There are times like you're gonna have to, in my own role, I have to go check. The surgeon has prescribed, for example, medication we call Zen Relief here. So Zen Relief is, kind of, it comprises of two medications, that's bupivacaine and 0.2% bupivacaine and meloxicam. So you're gonna have to look. Okay, this medication has meloxicam, and what's the patient creatinine? So creatinine, you're gonna know the normal range of creatinine, 0.5 to 1.1 or 1.2. So if the creatinine is high, no, you're gonna have to take the medication away. You don't have to come and ask the surgeon, are we gonna have to use this? Take it away and tell the surgeon, look, the creatinine is high. So then the surgeon will make the decision and plus, okay, okay, we use or not. So that's, by the way. Having said that, we're gonna have to go again here in the United States. There's also what we call um NLC, that's National Licensure Compact. So what this means is, like, there are a combination of states. Let me start primarily in the US. When you have a license in a particular state, you can't use that license to work in another state. So you're gonna have to do what they call endorsement of license. So, but this was the practice going on until early 2000. They come up with a sense of establishing what they call national, what they call national licensure compact. So in this sense, what this means is, there are a group of states that you could use a particular license to work in those states. So, like, for instance, I'm living in the state of Connecticut. Connecticut is not in NLC. So if I'm living in a state like Idaho, Texas, I'm in licensed compact, so I could use it to work in different states. So I'm gonna post the clip here, so the image here, so you can see what I'm trying to say. So that is also something. It filters, it trickles down from the system of government. States determine what they want to do, and that's it. And it's not a unitary one. States determine what they want to do. So having said that, then we're gonna go to the very interesting one. We call that remuneration. Mamma mia. She thinks she love me. I think she trolling. That girl is a real crowd, please. Small world, all her friends know of me. Mamma mia, mamma mia, mamma mia. So this is an interesting point. Everyone is interested. Remuneration, remuneration, oh, mamma mia. Yeah, having said this, man, remuneration here, it is what it is. It is what it is. Folks, you're gonna have to know that. Like, you know, understand the system of government, understand the healthcare policy, healthcare system in place. So here, for instance, in the US, we have capitalist healthcare system. So whereas in the UK, there is, they have socialist healthcare system, and you know, each one has its own upside and downside. But that's not what I'm here to talk about. So the capitalist healthcare system, that's well, okay. Let me start this way. Like, reasons why in the US you could earn potentially more higher than, even than anywhere in any part of the world, than any nurse in any part of the world. So here, capitalist healthcare system, it's meant like you can cash out. You are here to cash, everything is per billion, like you can cash out, whereas in socialist, no, in the civil service role, you are not there to cash out. You're there to, keep working for the interest of the public or the masses. So that is it. So other reasons why nurses earn potentially higher here in the United States is what I'm gonna around four of them. So skill sets as well. So skill set, like, and a specialty. So what that means, like, if you're a particular nurse in a particular specialty, Like I work in the operating room, for instance, and if I've grown my skill set massively, like, basically, from but top-notch procedures. Procedures are so complicated, like cardiovascular, like neurology, neurosurgical, and towards the other ones. So it increases my potential to earn higher. Then I'm gonna talk as well as experience, years of experience. So that's also applicable to me and some other ones. I think some people might mistake it when you come in here to the United States, for example. You are not gonna aim that massively, especially you're not gonna aim that massively. So you're gonna start from that low scale, then eventually you build up, you build up, you build up, you build up. Whether you employed by an agency or you have a direct hire, you know, most times you're not gonna aim so massively. So for me, for instance, I'm employed by an agency, so I can trace my trajectory like next year is gonna be 1 year. I just have 1 year more, and it is that after 1 year, whenever I finish my contract with the skill set, with years of experience, and with what again, skill set, years of experience, and it's gonna like you could I could trace my trajectory. Like I could imagine where I'm gonna be in the next. So, for instance, we were trying to have a I had a random discussion with one of my colleagues. So she's finishing her contract very soon. So she was like insinuating like some agencies you can pay off and all that. So I was like, how much could it be? She said $13,000. When she said 13,000, I said, oh my God. This is very big money, man. Yeah, yeah. She said, yeah, it's big, but if you could pay the agency off, for instance, you go and travel as a traveler, the least as an ORO and as an experienced operating room nurse, the least you could earn could be like 4,000. So 4,000 times 4 months, that times 4 weeks, 4,000 per week, so times 4 weeks. How much? 4 times 4 is 16. So you're gonna, it's enough to pay them off. I say, oh, really? Yeah, you have a point. You have a point. So having said that, so this is it. Skill sets, the specialties you are in will determine, how you're gonna earn. Some specialties are more valuable. I think this is a point I remember back in the UK. It doesn't matter whatever specialties you are in, it's a uniform scale of payment. So if you're wearing leather apron, for instance, to do a big surgery, neurosurgery, this, and somebody maybe somewhere else doing something at the pre-op or reception areas, you guys are gonna earn the same thing. That is it. Then another thing I wanna put is productivity. So like here in the United States, this is very applicable here. In this country, what what you could like what you could contribute that would churn out revenue would determine what you could earn. Like for instance, the resident doctors here, they don't earn much as nurses earn more. Some nurses or many nurses earn more than residents. Oh, where? Because what? As residents at that level, you're just a trainee. You're just doing a training program. So that's it. But until a resident becomes an attending, oh my God, money goes implodes because at an attending level now, you're handling the responsibility. You are the big guy doing the whole thing. So productivity also determines what you're gonna earn here. So as well as sometimes some people say bargaining prowess. Some places people could bargain higher, and if there is acute shortage of nurses at that very point in time, could also determine what you could earn. So these are things, but it's so much watering, so to say. United Kingdom, you are not there to earn much. You are just there what to contribute to this to the good of the public, civil service. So that's what you're doing there. But it's okay if you're an immigrant, the money you earn there is also, you know, or immigrant rather, the money you earn is also enough, but it's not much compared to what you're earning, what you're gonna earn in United States. So having said that, I'm gonna talk up the next one. That's career progression. Here in the US, for instance, the nursing bandwidth is so very enormous, so very large. Like you could progress to many things as a nurse. For instance, and These are things that have taken place over a period of time and it's still, still going on. For instance, in the operating room, even a surgical CST, certified surgical tech, could advance and become what? First assistant in surgery. And this has been happening since many years back. So as an RON, you could go to clinical role in operating room if you want. You could increase to become an RNFA, become, CRNFA, that's certified research nurse assistant, or you could become, go through the MP route and become what? First assistant under MP. And that is like top notch. So when you are an MP, you're a nurse practitioner, in surgery, so your roles are kind of, like your remuneration comes from the insurance company most times. So there are many things you could, many roles you could assume here. And being a nurse, and the career progression is, you could see that, you could trace that, what you could progress to be. In the UK, I don't know about, personally, where I worked by, it was like I could see someone, and I know people, someone could be like a scrub nurse for 30 years, for 20 years. I ask myself, like, what what's going on? Like, how are you able to, keep on doing it? Like, submitting an instrument to the surgeon for 20 something years? Isn't that about Einstein that says that nothing defines insanity than doing the same thing over and over again? Man, how did you have that? I mean, I can't be normal to do that. I don't know how to do that. So, and sometimes what is obtainable in their area, but generally it's not so broad like what you could be here in the United States. So having said that, I'm gonna move to the next point here. I'm spending much time in this video. I really didn't intend it to do that. So I'm gonna move to the next point here. So we're gonna talk about what we also call like we're gonna talk about value at the end of it, and as well as something like outfit, and exposure to technologies as well. So here in the United States, you work with top notch technologies, top notch like you know, like the time I came in, there are a series of things that are being material management system, Texas, so surgical, adjunct surgical, surgical count system. So now what that means is, you have to scan your gauze or swab and put it in a rack, so you could just see it from the monitor. Look, your swab is not complete. You go back and count again. Okay. So you are very much exposed with top-notch technologies and health infrastructure. It's a billion-dollar industry here. So unlike in the UK, you know, you don't see this everywhere. You could see it in just very few places, but you may not see it everywhere. So that is it. And I will go to the next one here, indemnity coverage, and as well as go to work hours. So here in the US, immediately you're stepping in, it's always advised to what? So you know, set up an indemnity coverage, to back you up in in any phase of litigation. So in the UK, I don't think if you're working in a very like your primary place of employment, most people don't worry about that, except you feel you are winch hunted, humiliated, and things, and some people could go take from register with ROCN to provide coverage for them. But maybe when you do agency shift in the UK, maybe you need an be with ROCN to provide. But here in the US, primarily you are coming in, they're gonna say, okay, it's advisable to set this up because you never know what can happen here. So I'll go to the work hours as well. So here in the US, people work 40 hours per week or 36 hours per week. In the UK, it's similar. People, but not exactly. In the NHS, it's 37.5. In private sector, it could be 40 hours per week. However, having said that, you know, we should get to know, look, like, yeah, even if it's the same 40 hours, the work roles a nurse do, does here in the United States, or do here in the United States, are so vast and they could be consuming, and the nursing itself is so daunting. Unlike what you get, it could be daunting, it could be tiring, unlike what you get, unlike what is obtainable in the UK. So Having said that as well, we'll go to another very salient area like work life balance. So how do you see that? I think in the UK, this is where US is very, very low. This is not a country to to give you holidays or vacation. No. In the UK, 6 each year, if it's in the NHS, it's 6 weeks. You're entitled to your 6 week annual leave every year. And also some private, establishment also do that. But here in the US, oh my God. Hmm. Oh my God. Like this is a very big leisure. If you are in the UK, this is a very big leisure. Like it's something else you are enjoying that is far, far, far out of reach for us here in the US. So like for me in this for me, for example, I had to approach my agency to find out like I needed to get a day off to go for my driving test. This can I know the number of hours I'm entitled to? Yeah, they use the term PTO, paid time off. So can I know? They sent it to me. I think it was in October, so that I have 38 hours. I said, really? Since January, I've been working till now. You mean what I have is just 38 hours? Oh my goodness! And I went back to check. There's this each week that you are entitled to 1 hour. Each week you're entitled to 1 hour, 1 point something hour per se. So, oh my God, like looking at it, I was, this country is not a place to give you free time. No, you just have to create free time by yourself. So that's by the way. We'll go now to the next one. We call we're gonna say okay something about the value of nursing and as well as some of my one of my last observations like outfits here. Okay, let me go to value first. Value of nursing. Some people will make an argument like, oh, because the monetary, terms or the monetary reward that is more valuable here, than in the United Kingdom, is more valuable here in the United States than in the United Kingdom. And, you know, all man to his tent anyway. But I think it could be a narrow sense of argument, i- i- because sometimes you could get the money, things you could things you're entitled to in the United States, you might not be entitled to it here in the US. So that's a different video, I'm gonna do for next time. So in my own opinion, I would say here, nothing has more value and outside from my own experience. So apart from from the educational model, let me start from there. It sieves the best out of the best. In that way, there is this mechanism of economics taking place here. So when you say when the supply when the demand when the supply is low, it makes a particular commodity to be so treasurable. So here you can't just wake up and say in 3 years I'm gonna be a nurse. No, no, no. Unlike in the United Kingdom, pass your semester courses, that's all. No, you being a nurse here is subject to you what? Passing your NCLEX examination. So if you don't pass, if you even if you graduate, whatever many years back, and you've not passed this exam, you're not gonna practice as a nurse. So in that sense, it's not for the faint-hearted. It sieves out, brings out the best out of the best, in my own opinion. And yeah, the monetary reward as well, it comes in as well. It's so high. Well, again, what I've experienced here is like when you are coming in as a nurse in the United States, like, you know, there is this status accentuation, like it's denoted by look. If somebody can give you credit because what they believe you're a nurse, like you can afford it. If you wanna go for that, you can afford it. If you wanna, if you build, get a little bit, let's say capital or something, and say, okay, yeah, I wanna get a mortgage. It's very easy because they know stability. You have stability being a nurse. Nobody's gonna bother about you not paying or something. Like in my own instance, once I sent my what's it called, social security, I know a lot of credit card people coming, calling, like, no, I don't want it anymore. So that's that's from my own inference. It has a lot of value here, compared to the United Kingdom, yeah. people appreciate it, but it's not like that. And here as well in the US, people appreciate whatever not everybody, but a lot could appreciate you know the depth of services you provide here. So the last thing I'm gonna talk here is very, very, it could be insignificant, but it's part of my observation as well. And it's something I wish to share. I mean, it could also be very what will I say, for the ladies as well. It's something that we wanna know. Like here in the US, um, the outfits of nurses here, is different from that in the UK. So here you could see very appealing outfits, fascinating outfits, and different colors, scrub, whatever, you know. And again, what sometimes I say to myself, like, is it like the principles of freedom of democracy playing in here into this country, whereas in the UK, and now they're so conservative about it. They don't want to do any, they don't want to go too far with it. Like my experience where I worked in the UK, I'll show the clip. The surgical cap. I think it was one surgeon gave it to me many years ago. So for me, I didn't even like I didn't forget about it. Left it in my bag. I never wore it. So, but one guy was having issue with the hairnets. He do put on. So I suggested him, I said, bro, since your hair is dripping, would you consider like putting on the surgical, cap? And the guy told me, no, we are not allowed to put it here. I said, really? Yeah, you are not allowed to put it. My God, but the residents do put F1, F2, they do put that. So why? I don't know. It is what it is. So guys, that is it. I'm trying to go through things I can as much as I can here. Um, but I'm gonna summarize with some good news anyway. But before then, I will have to. I forgot to put this like here in the US, like especially when you are an internationally trained nurse, for example, um, you know, there are vast opportunities for you here. Definitely, it's when you get yourself, established, get yourself years of experience and all that. But that's by the way. So to close it all now, the good news is this: if you're anywhere and you're trying to get whether to the UK or whether to the US, and you want to practice, if you are not nurse yet, you want to practice. Excuse me, you want to practice as a nurse, and you know we all know what the exams are. In the UK, you take CBT and IELTS as an English competency test or OET. So in some countries, maybe lack they are absent of OET centers or it's very expensive. So a lot of people end up taking IELTS and all that. So having having passed through these very two processes, so both the IELTS and the NCLEX and whatever. So I've seen a lot of people struggling with it. So struggling with this exam, even the NCLEX, like I never knew. I thought like, oh, once you train in the United States, maybe you train at Harvard, Ivy League schools, you could always pass the NCLEX. Bro, no, no, it doesn't happen that way. People struggle to pass the examinations. Yeah. So anyway, if you're struggling with these examinations and you're finding it difficult to get a grip on it, look further no more. We are here to give you the best assistance we can, provide you the strategic insight on what you need to pass this exam. For instance, the NCLEX, it's not for the faint-hearted. Some people call it like a marathon. So you need to understand it, get an insight. Like for me, the NCLEX model as examination model is based on a framework, what I would call blunt taxonomy. So what that means, like there are questions that appear, there are questions at a knowledge level, at understanding level, then at analysis level and application level. So analysis, application, and analysis are the top notch. So if you are able to have an insight, a strategy on how to, approach those questions, and you are able to keep, during the exam, you're able to do well, on questions that analysis and stuff, that means you're gonna pass. So, but if you're failing at, if, that's also to remind you, NCLEX is computer adaptive test. So, if you fail question at that top level, which is application level, brings you down again. You fail question at maybe analysis level, oh, the computer brings you down again, and you further descend down to what we call danger zone. So knowledge and understanding, these are very low questions. So if you keep on at that level, at that area, you are not answering, you're not making effort, you're not getting the right question, you're not getting questions right to push you to to a fair area. That means you're gonna fail the test. So that's it. It's a little bit difficult to explain, but that's how NCLEX work. So guys, thank you all for stopping by to watch this clip. Stick by further for the next for further videos I will have to share here. So look at your screen, you'll see how you could get across to us. That's UG World, www.ugworld.org, and you could see as well the email you could as well use to reach out to us, and let's see how we could be of help. Okay, thank you guys. Do have a nice one.